So this is the new Siemens equipment. It's the same equipment that we have in the Penticton Hospital in the new tower. So it's a lot more automated what we're used to in this department. So a lot of it will auto track. It has datons that it'll find on its own. So it's locked in here and they'll lock in this way.
Oh, okay. So how does that help?
So that, we've always had the datons, but now we have sensors in this that track where our tube is. So I can press a button and it goes right where it needs to be. So I'm not constantly going back and forth, moving this and then centering this, and it'll follow it whichever way. So we can actually use this board as a tabletop also.
So does this machine use less radiation?
Much less, and it's much better quality images with the radiation
Oh,
it's
is
using.
that-
Now we have the removable DR cassette. So we have this one in here. Keep it in here. You can use this as a table also.
So when
And
you
these
take
ones-
X-rays, does that?
Yeah, so we take a
That's
picture
it.
on this board or that board,
Okay.
and it gets sent straight over to the computer. So as soon as I press the button in the control station, I can see what I'm looking at on the computer screen. That's it. Kind of closer to film, but still like quite a bit more advanced. These ones, when it's instantaneous and we can just come out and start positioning again, exams go by 2 or 3 times as quickly,
Okay.
quite a bit faster. So we're starting scheduling now to adjust and make our exam times a little shorter so we can fit in more patients. But that'll kind of come with time once our training is
So
completed
is
a little more.
15 minutes a reasonable time, or?
10 or 15 minutes is regular. Chests, things like that that are super quick hands, we can knock out a few in 10 minutes. This is all the way down, and then we can move it up, and it stops in increments. So
Oh, that's good.
it stops here, which is a safe working level.
It's especially rewarding for us because it's going to our own local hospital, because most of our funding ends up going to Penticton, which is used by the Summerland people, but it's nice to see it put in our hometown. Without the terrific support from the people of this community, both buying and donating, we wouldn't be able to raise any money at all. And we should thank the fact that we have approximately 180 volunteers that put in a lot of hours to make sure this works.